So today's session, we will discuss vitamin C. And after the class, after vitamin C, we'll discuss a bit on the assignments as well. Those who have done assignments, I have received it. Okay. Last week, students who were present in the class, who have done the assignments, I have received some of it. Also, those who have WhatsApped me the assignment, make sure you have mailed it also. So vitamin C, page number 400, those who have the textbook, page number 400, chapter 21, vitamin C. If there are any changes in your textbook regarding the page numbers, please mention in the chat box. New book, page number 405. Old textbook, it is page number 400. So vitamin C. So another name for vitamin C is ascorbic acid. There is a lot other names as well. Okay. Ascorbic acid, hexuronic acid, anti-scorbutic nutrient. Okay. These all are other names of vitamin C. And you have to learn these names. Okay. Questions around these names will also come in the exams. So be aware of that. Okay. Learn these names as well. Other names of vitamin C, other name of vitamin D and all. Okay, whatever is available, the facts that are given in the textbook, please follow that. Okay, underline those statements. MCQ questions regarding these will come in the exams. Okay, so vitamin C, it's an odorless, colorless vitamin, but it's sour in taste. Okay, it has a taste. It has a very distinct taste, which is sour, and it gives that sour flavor, citrusy flavor to the fruits as well. Okay, and these are very active. Vitamin C is a very active nutrient, which means it is a very potent antioxidant. Okay, on the image shown on the screen, you can see this is an image of a vitamin C serums, which are very commonly used in cosmetics right now. So when it is in its active form, most potent and active form, remember it is colorless, it's clear. Okay, but when it slightly begins to oxidate, okay, when it undergoes oxidation, it will start changing its color, and with more and more oxidation, it will get darker and darker, from clear to pale yellow, golden yellow, amber like color, and brown. Its potency will also decrease because it has undergone oxidation. Okay, oxidation means it has reacted. It's an antioxidant. It's a very active, hyperactive antioxidant, and it will react with the free radicals. It will give up itself. What are antioxidants? Antioxidants are like these potent nutrients that are ready to give themselves up for the health of your tissues. They are ready to fight the free radicals. Okay, so that free radicals don't damage your healthy tissues. That's how antioxidants work. Okay, so it is water soluble. Vitamin C is water soluble, which means your body cannot store it. Okay, vitamin C cannot be stored in your body. You will, when you urinate, when you sweat, okay, you lose vitamin C. Okay, so it's water soluble. And the disease of the vitamin C deficiency leads to scurvy, which is very rare these days. Okay, but it was commonly seen in sailors, people who used to go on sailing. They didn't had access to fresh fruits. When you are in the middle of the ocean, you don't have access to fresh fruits, fresh vegetables, so you become deficient in vitamin C, and scurvy is a disease that was very commonly seen in sailors. Okay, and then in 1747 it was seen that when you give oranges and lemons to sailors when they use it, and it has started curing the scurvy. And what is scurvy actually? Everyone has wound. Okay, everyone, each one of us has wound and scars on our body. Okay, we must have got hit somewhere. We have wounds and scars on our body. You look at your scar, it's kind of a temporary fix that your skin has done. But when you go into an extreme deficiency of vitamin C, your scars will begin to break down again, because the scars are kind of a temporary fix done with collagen. Okay, collagen is a protein in your skin. Okay, with the help of collagen, elastin, a temporary fix is done. But when you have scurvy, the body will require this collagen back, and it will try to break down the collagen proteins back for body's use. So the scar which you think that it is healed, it's okay now, it will start to deteriorate. You will re-scar yourself in the same place. Okay, that is the extreme deficiency of vitamin C, scurvy. Okay, is it clear to all so far? So the chemistry part of vitamin C, you don't have to study that. Okay, chemistry part, that is the biochemistry part, you don't have to um, by heart any of that. Just understand the facts from the chemistry session. Okay, so it is a very hyperactive antioxidant, and it is very susceptible to deoxidation. Okay, and most of the mammals apart from humans, okay, humans and monkeys, mammals can synthesize vitamin C in their own body from glucose. Okay, from glucose itself, their body can make vitamin C, but human bodies cannot. Okay, humans lack this enzyme which can convert glucose into vitamin C. So human body and apes, chimpanzees, monkeys, okay, these species does not have this liver enzyme which can convert glucose into vitamin C. Okay, so that's the reason why man, monkey, guinea pig, okay, Indian fruit eating bat, red mented bulbul, these are the certain species who require regular supply of vitamin C through food, through their diet. So major functions of vitamin C, coming to the major functions of vitamin C, the first main function is collagen formation. And because of this major function, vitamin C is used in majority of your anti-aging products. Okay, because after the age of 25, after the age of 25, collagen is still produced in your body. Okay, it's not that after 25 your body will not produce collagen. Collagen is still produced in your body, but the rate of production is low. Okay, so you need good quality collagen in your formation that should take place in your body, and vitamin C supports it. Okay, vitamin C helps in the formation of collagen. You can see that in this diagram. Amino acid is protein. Okay, amino acids are the building blocks of protein. What are protein? Proteins are amino acids. Okay, many different permutations and combinations of amino acids come together and they form a protein. Protein is there in your diet. You take in protein, again the body will break it back into some other form of amino acid. Okay, so amino acids that you get from your food, they react with vitamin C. Okay, certain enzymes and fibroblast that is present in your cells. Okay, your cells have fibroblast. Okay, so these together, they come together and they form collagen molecules. Collagen molecules will multiply and they form a collagen fiber. Okay, and collagen fiber, you see here the final result, these are the pillars. These because of collagen fibers, they hold your skin up. Okay, when you start losing your collagen fibers, that's when your skin falls down and it forms wrinkles. Okay, so collagen fibers are what gives that plumpness to your skin. Okay, it holds your skin up, it holds your skin in a plump position. When you lose collagen fibers, okay, there is nothing to hold your skin upright. the skin falls into its own hollows. Okay, and that's how you get wrinkles. Okay, so the main function is collagen formation. Collagen is a major structural protein in your body, and also for bone formation, collagen is required. 1/4 of all the protein in your body is collagen. Okay. Next function is carnitine synthesis. Carnitine, again, it's a nitrogen containing compound which is important in mobilizing fat. Okay. You eat some fat rich food, your intestines are absorbing this fat. Okay, but this fat should keep moving within your body. As soon as your fat stops moving, it will stick to wherever it is. If it is the blood vessels, it will stick there, stick to the blood vessels, and it will form some cardiovascular issues. So fats in your circulation should not stop, they should keep moving. And what helps the fat to keep moving? It's carnitine. Okay. L-carnitine is also supplements. It is notoriously known for weight loss and all. Okay, you take more carnitine supplements. You're just moving a lot of fat in your body. Okay, it actually, we do not have any concrete proof that says that yes, L-carnitine will help in weight loss. We do not have that. We do not have that evidence-based statement yet. Okay, it's not a proven fact, but we know the function of carnitine. Okay, function doesn't mean it aids in weight loss. It's the function of carnitine. Okay, so carnitine is a nitrogen containing substance that helps in transporting your fatty acids, fats, into the mitochondria. Okay, and when the fat gets into the mitochondria, this fat will be broken down to give you energy. Okay, so that's how they came into a conclusion that carnitine is a very important substance for weight loss. Okay, it's not true. We haven't found a positive correlation between carnitine supplements and increased in weight loss. Okay, those studies have not been concluded yet. Okay, so for to make carnitine in your body, vitamin C is required. Okay, the neurotransmitter synthesis. Copper containing, there are copper containing enzymes like dopamine oxygenase. Okay, these are neurotransmitters. Neurotransmitters means they will help in the secretion and pushing the dopamine forward. Okay, dopamine is kind of a happy chemical. Okay, the more serotonin and dopamine your brain is able to produce and secrete, okay, the more you stay away from mental health disorders like depression. Okay, so to make this neurotransmitter that can help carry dopamine in your CNS, central nervous system, vitamin C is required to make this enzyme. And vitamin C is also used in the synthesis of serotonin. Again, serotonin is also another happy chemical that you have. Okay, it is a mood lifter. Okay, dopamine and serotonins are mood lifters. So to transmit dopamine and to synthesize serotonin, vitamin C is required. Then activation of hormones. Many peptide hormones or hormone releasing factors, when they are synthesized in the body, okay, vitamin C is essential for their activation, like calcitonin, gastrin, oxytocin. These are different hormones. Okay, thyrotrophin, corticotrophin, vasopressin, growth hormone releasing factors. Okay, for the activation of these all hormones, vitamin C is required. And adrenal gland is an endocrine gland present on top of your kidneys. Adrenal glands rest on top of your kidneys, and these are the glands which utilizes high levels of vitamin C, especially when you are in a stressful time, you are in an anxious time. Okay, these adrenal glands are hyperactive and they utilize a lot of vitamin C for synthesizing and secreting corticosteroid hormones. That corticosteroid hormones are required to manage stress and anxiety. Okay, so a lot of hormone activation job also vitamin C has to do in the body, human body. Then prevention of cataract. Vitamin C reduces the risk of cataract, because what is cataract? Free radicals have started attacking the healthy lining and tissues of your lens. Okay, eye lens. Synthesis means to make. Okay, to produce or to make. So when you don't have enough vitamin C in your food, that will lead to destruction of the healthy cells in your lens. Okay, and that's how clouding of the lens will start, and it leads to cataract. Okay, so vitamin C can prevent that oxidation of your lens. Then cholesterol metabolism, as I have mentioned, the more the more carnitine you have in your body, fats will be mobilized. Fats will be taken into mitochondria to break down and produce energy. Okay, so automatically cholesterol is also a fatty acid that is getting metabolized. Okay, and vitamin C helps in the synthesis of bile salts. Bile salts are found in your liver to make bile juice. Okay, and bile salts present in the bile juice, they break down fat. Okay, not chemically, they just break down the physical structure of fat from big globules into small globules. Okay, so that's how bile to produce bile salts and bile acids, vitamin C is required, and they lead to cholesterol metabolism. Maturation of erythrocytes. Vitamin C is useful in the reconversion of methoglobin to hemoglobin. Okay, reconversion usually takes place in your spleen and all. Okay, where old worn out hemoglobin reaches. Okay, and the spleen will scavenge the old RBCs, store the heme, store the iron from the old RBCs to form new hemoglobin, new RBC. Okay, so so that your RBCs, red blood cells, mature, undergo maturation, vitamin C is required. Vitamin C tablets exclusively for depression is not prescribed as a vitamin supplement, because when a person is undergoing depression, not just vitamin C, they will require a lot of nutrients as well, because they lose their appetite. Okay, in majority of the depression cases, people lose their appetite. So those cases, not just vitamin C, they may undergo other deficiencies as well, which has to be corrected with multivitamins. Okay. So that in this manner, vitamin C is required in the maturation of your RBCs in the bone marrow. So when you come to the life cycle of erythrocytes, okay, a lot many organs are involved. Even your liver is involved. Okay, because the old RBCs have to leave your body. Worn out RBCs have to leave your body. New RBCs has to be formed in the bone marrow. Old RBCs will undergo scavenging in your spleen. Okay, so vitamin C will be used in all of these three different organs for three different purposes. just to produce good quality RBC in your body. In the bone marrow, vitamin C is required so that RBCs undergo maturation. In the liver, your vitamin C is required so that bile pigments, hemoglobin, can degrade into bile pigments and that can be used up in the body. Okay. In the spleen, also vitamin C is required to convert methoglobin into hemoglobin. Methoglobin is a form of the protein, okay, that has been stored in the spleen. To convert that into hemoglobin so that the body can use it, vitamin C is required. Okay, so in three different organs for three different purposes, vitamin C is required. But the bottom line is all these three organs are working towards the maturation of RBCs. Erythrocytes means RBC. Okay. Cholesterol metabolism, same. Cholesterol is also a fatty acid. Okay. The more vitamin C you have in your diet, you will have more bile salts as well. On top of that, carnitine is also produced in your body. So in two ways, bile salts will help to break down the fats in your duodenum, in your intestine. Okay. And once it is in your circulation, carnitine will help the fats to be taken up by the mitochondria. For both these purposes, vitamin C is there to help out. Okay. Then drug detoxification. Within the body, various drug detoxifying mechanisms is present, especially in your liver. Okay. So vitamin C is required because byproducts of this detoxification leads to a lot of free radicals. Okay. And these free radicals can again cause more damage. To combat that, the presence of vitamin C is important. Okay. Even in the liver, certain enzymes, production of certain enzymes are required so that vitamin C can help in the detoxification. Then it is a general antioxidant, a very hyperactive antioxidant. So what makes vitamin C a hyperactive antioxidant? It is the free electron that vitamin C has on its outer shell. Okay. If you remember the basic chemistry of an atom, okay, protons and neutrons are in the center, in the nucleus. Okay. Electrons are revolving around in orbits around an atom. Okay. So the outermost shell, the electrons at the outermost shell has, that is more easy to be lost. Okay. And it carries the charge. Okay. It carries the charge. Vitamin C is negatively charged. It has an electron that it is ready to lose so that it can stabilize. And free radicals, okay, they want a negatively charged negatively charged electron so that they can stabilize. Free radicals will go and attack the tissues for this negatively charged electron. But when vitamin C is readily giving up its negatively charged electron in the outermost shell, okay, it stabilizes vitamin C as well as it stabilizes free radicals. So free radicals cannot cause more damage. So that's how vitamin C acts as an antioxidant. Okay. Am I audible to all? Then for iron metabolism, vitamin C acts as an reducing agent. What what is a reducing agent? That is able to keep the ions in check. Ions are charged particles. Okay. So they keep the ferric ions in their ferrous form. And when the ferric ions are in the ferrous form, only then they can be absorbed. In ferric form, when they have that specific charge on them, iron molecules will not be absorbed in the intestine. Okay, they have to be converted into a ferrous form. Only then it can be absorbed, as I have mentioned earlier. Okay, vitamin C. Vitamin C, when it loses its that one electron, okay, after that loss, it is able to stabilize another particle. Okay, when it is a ferric ion, when it is a ferric ion is again, it is in an active form, it is incomplete of its charge to become a ferrous ion. So for a ferrous substance, it has to gain an electron. Okay, it has to gain an electron, and after gaining an electron, ferric ion will become into a ferrous form. Okay, so vitamin C, as I mentioned, it will give up its electron. It will convert ferric ion into the ferrous form, and now your iron can be absorbed by the intestine. So this is the reason why vitamin C is required for iron absorption. Why? It's just basic chemistry. Vitamin C is a hyperactive antioxidant ready to give up its electron to stabilize the condition. Okay. The forms in which iron enters your body is not an appreciable form in which absorption can take place. Okay, it has a as a ions have a charge. Okay, to neutralize the charge. Okay, and then absorb the nutrient. For this purpose, vitamin C is required. Is it clear to all? Just like how vitamin C acts as a uh, just like how vitamin C acts as an antioxidant, the same mechanism is followed in iron absorption as well. Just giving up its electrons. Okay, just giving up its electron, stabilizing the iron, and then when things are stable, absorption will take place. Okay. Is it clear to all? And at least 40 mg, at least 40 mg of vitamin C should be available in your intestine for iron absorption to take place. So when if you're having a multivitamin tablet, taking vitamin C supplement and taking iron supplement together will be beneficial. Then there are other small functions like cellular respiration, tryptophan metabolism, immunity. Okay, these are also the functions of vitamin C. As I mentioned, vitamin C is involved in electron transport chain. So it helps in cellular respiration, taking up oxygen, giving out carbon components into the bloodstream. Tryptophan is an enzyme. Okay, for its hydrolyzation also vitamin C is required. And because of this tryptophan enzyme, serotonin can be produced in your body. Vitamin C can enhance the synthesis, production of immunoglobulins in your body, and it can increase the activity of your white blood cells. Vitamin C can increase the activity of your white blood cells and also immunoglobulins present in your body. So that's how it improves your immunity. So these are the other functions of vitamin C. And how does absorption of vitamin C takes place in your intestine? Okay, so consider this enterocyte. This is one cell, one single cell of your small intestine, enterocyte. Okay, so this is ascorbic acid. Okay, ascorbic acid, and this is SVCT1. This is the vitamin C transport protein channel present in your intestine. Okay, intestines have these many channels present here and there, and these specific channels are used by nutrients to enter into your cell. Okay, And as SVCT, it's translate into sodium dependent vitamin C transporter. S stands for sodium, VC is vitamin C, T stands for transporter. One is channel, transporter channel 1. So sodium dependent means, for example, if you are having lime juice, when you are having lime juice, you should add a pinch of salt into it. Okay. Presence of sodium will open up the pathways for vitamin C to enter the cells of your intestine. It's a sodium dependent vitamin C transporter. Okay. So in the presence of sodium, when your diet has sodium and vitamin C both together, it's very easy for vitamin C. ASC is ascorbic acid, vitamin C. Okay. Very easy for vitamin C to use this sodium dependent channel to enter the intestine. And from the intestine, directly through diffusion, it will get into your bloodstream. Okay. Just to enter the intestine, it requires a sodium dependent channel. Okay. And majority of the vitamin C ascorbic acid is absorbed in the jejunum. Okay, as I mentioned earlier also, your small intestine has 3 sections: duodenum, jejunum, ileum. Okay, these are the 3 sections of your small intestine. The C-shaped part is the duodenum. Okay, then you have the jejunum. So in the second part of your small intestine, that is where the majority of the vitamin C gets absorbed. And there are different forms of ascorbic acid, and out of which dehydroascorbic acid can enter the intestine passively. It does not require any channel or any mechanism. If your intake increases, if you overly consume a lot of vitamin C based food, okay, absorption level will fall down. Automatically, your intestine will shut down absorbing vitamin C just to protect your body from toxicity. Okay. If more than 1 gram is consumed, absorption decreases, vitamin C absorption decreases by 50% almost. And vitamin C can be filtered through kidneys because it is water soluble. So on a daily basis, you have to eat something that is vitamin C rich. So the absorption, is it clear to all? So vitamin C is quickly absorbed from the gastrointestinal tract, that is your small intestine, and distributed into your body immediately. Highest concentration of vitamin C, I mentioned earlier, it is found in your adrenal gland. Okay, these questions can come. In which part of your body is the highest concentration of vitamin C? Okay, that is the adrenal gland. Because when you are stressed, adrenal gland will use the vitamin C to form corticosteroid hormones to manage your stress. Okay. Then with some amounts in kidneys, because kidneys are filtering out. Okay, so some amount of vitamins is present in kidneys as well. Spleen and liver, as I mentioned, because for maturing the erythrocyte, for production of erythrocyte, converting methoglobin into hemoglobin, different part of the body which are involved in your RBC production, red blood cell production, vitamin C will be present there. Okay, whichever part of the body red blood cell production is organs involved in red blood cell production, vitamin C is involved there. Okay, your pancreas, thymus gland, pituitary gland. Okay, all these glands have vitamin C because precursor of certain hormones, activation of certain hormones, vitamin C is required. Once the tissues are saturated, once your body has enough amount of vitamin C throughout, okay, excess of vitamin C, if it is present in your body, it will be excreted out by kidneys, okay. Vitamin C can manage cholesterol by breaking it down, okay. Cholesterol reduction can only be done if you control your diet. That is the first way of reducing cholesterol. Now coming to vitamin C deficiency. So majority of the signs and symptoms are these: dry, split ends of the hair, slow wound healing, okay, easily getting bruised, okay, dry skin, gingivitis, inflammation of gums. Gingivitis means inflammation of your gums, frequent nose bleeds, very common in children, okay, very common in children because kids don't enjoy eating a lot of fruits or fresh fruits or vegetables, so that leads to a lot of nosebleeds, joint pain, immune impairment, digestive disorders, okay. So these are the signs and symptoms of um, vitamin C deficiency. Also, in a study mentioned in your textbook, guinea pigs were used in a study to determine the effect of vitamin C deficiency. So you can see in the image, in the first image, diet which had adequate, which was balanced, but it didn't have vitamin C. Everything else was balanced. Every other nutrient was balanced in the picture A. Okay, the size of the guinea pig, you can see how the guinea pig looks. You can see everything was perfect except for vitamin C. There was no vitamin C in the diet. Okay, and in second pig, you can see the same guinea pig, when vitamin C was added into the same diet, which was complete, but only with one single change by adding vitamin C. You can see the difference in both the guinea pigs. Okay. And the guinea pigs were of the same age, same sex, born together. Okay. And 22 days they were on this diet. The guinea pig, which was given no vitamin C, had very rough fur. The position of the body was not formed well. Okay. The guinea pig had sore, painful joint. But the other guinea pig, when you compare both the image, you can see how well developed it is. Okay. The softness in the fur, the length, the body development is adequate. Okay. So that shows the importance of vitamin C in diet. In humans, listlessness, fatigue, weakness, shortness of breath, muscle cramps, bone pain, joint pain, muscle pain, loss of appetite, these are seen in humans. Okay. There are different stages. Stage 1 is like lethargy and fatigue. You are too tired because your fat is not, whatever fat you have in your diet is not adequately used to give you energy. Okay. It's the fatty acids are not reaching mitochondria to give you energy because you may be lacking carnitine. Okay. In stage 2, your gums will start bleeding, very common. Okay. When you start brushing, gums will bleed. Stage 3 is anemia. Vitamin C, as I mentioned, in various pathways, vitamin C is involved in red blood cell formation. Okay, so absence of vitamin C would lead to anemia. Stage 4 could be high fever. Yeah, these are the skin symptoms you see in vitamin C deficiency. As I mentioned, easily you will get bruised. Okay, and blood clots are formed beneath your skin because There is no enough collagen to protect your skin. Okay, immediately a small scratch or small tug on the skin can also cause an internal blood clot. Okay, so this is what you can see in your textbook as well. Petechiae, you see this blood clots under the skin. This is called petechiae. On thighs, on your shines, okay, blood clots are present. Nails become this brittle, and they have splinter in the nails. Okay, split in the nails. In your textbook you can see a form of hair, lots of kinks in your body hair. It gives a corkscrew kind of hairs. Okay, lot of kink in your body hair. Kink means bent, not curls. Curls and kinks are different. Curls are like there is a smoothness in curls, but it has a spiral shape. Hair has a spiral shape, that is curls. Okay, kink means bent hair. A straight line, when you bend it, it does not become wavy or curly. It is just bends, zigzag. Okay, that is corkscrew hair. Page number is, if you have the new textbook, it is 410. If you have the old textbook, it is 405 to see these images. And even at this stage also, when you don't cure your vitamin C deficiency, this is where the next step happens. Your own scars, wherever you have scar on your body, small scar, big scar, wherever you have scars on your body, these scars will break down. Okay, the way how you were bleeding when you got the scar years back, even if it is a 10-year-old scar, 20-year-old scar, okay, these scars will start breaking down, because scar area is kind of a lot many collagen was brought together and stuck together, okay, to stop bleeding. Scar is kind of a temporary fix. Okay, collagen fibers are brought together. Okay, they are condensed together and uh, stick into the skin. They are stuck into the skin in such a way that bleeding will stop. That is what a scar is. But when there is no collagen formation happening because of the absence of vitamin C, the body will go to these scars. They will take away the collagen from the scars, and now collagen is gone from the scars, means the scar tissue will collapse and it will start re-bleeding. Okay, that is the most aggressive state of vitamin C deficiency. Okay, sources of vitamin C in India. Indian gooseberries, amla is kind called the queen of vitamin C. Equally, one amla, the vitamin C concentration in one amla is around 252 mg per 100 gram. Per 100 gram of amla has around 252 mg of vitamin C. So at least if you have one amla a day or two amla a day, your vitamin C requirement is fulfilled. Okay. You can do your serum test, blood serum test. Vitamin C, as you have seen in the absorption, as soon as gets into the intestine, it actively it diffuses into your bloodstream. Blood serum analysis can be done to find out, are you deficient in vitamin C or not. Okay, and also the Indian fruits, like tropical fruits like guava. Okay, 222 mg of vitamin C per 100 gram. But when you cut these fruits, you can use vitamin C tablets as well. Okay, if fresh fruits are not available, or your diet does not have enough fresh fruits, you can definitely use vitamin C tablets. Supplements can be used to meet the requirement. If you cut the fruits and store them, even if you refrigerate them, you lose vitamin C. Okay? You cut the fruit, even if you pack it in a tiffin or dabbas, you will still lose vitamin C just by exposing the fruits to open air. Okay, even inside a tiffin box, air is present, right? If you expose it into to an open air, you will be losing vitamin C. Okay, so what you can do, if you're doing some meal prep and all, you have to cut the fruits. You do not have time to cut it later. You want to pack a tiffin or something. uh, Take lemon as well. Just before eating the fruits, squeeze some lemon on top of it and then eat it. Okay, so you're bringing back the vitamin C into the fruits. Okay, drumstick leaves, agathi leaves, these all are good sources of vitamin C. Milk, meat, cereals, pulses are poor sources of vitamin C. Okay, sprouted legumes and pulses, they also have vitamin C, but not the original form. Orange, lime, lemons, jackfruit. Raw jackfruit has more vitamin C as compared to ripe one. Raw mango has more vitamin C as compared to ripe one. Of all the vitamins you will study, vitamin C is the only vitamin that is exposed to, if it is exposed to open air, it can be destroyed. Okay, if it undergo oxidation. You are just see, when you have a bowl of fruits kept in front of you. Okay, if it was kept out or in open for a bit of time, half an hour or 1 hour, half of the vitamin C would be lost. Okay, you're adding lemon because lemon adds a good citrus flavor. Okay, and you know the cut open fruits have, you have lost the vitamin C. Just by adding lime juice, you know that you are adding the lost vitamin C back into the fruits. Okay, it's not that the lost vitamin C from the fruit will come back to life. No, it's not like that. You're just adding an additional source of vitamin C. Bell peppers, papaya, guava, Indian gooseberry, broccoli, lemon, kiwi fruits, tomatoes, strawberry, peas, orange, mango. These are all good sources of vitamin C. And when you cook a food that is rich in vitamin C, okay, these are the percent of vitamin C that you're losing. If you cook capsicum, pepper means capsicum. Okay, you cook capsicum for 5 minutes, 11.76 percentage of vitamin C is lost. You don't lose vitamin C of amla when you make a juice of it, but you have to use it immediately. You make a juice of amla, immediately strain it and drink it in the next 10 minutes. Okay, don't store amla juice. Okay, stored amla juice or store bought amla juice is not efficient at all. Okay, if you are cutting lemon, make sure you are not keeping the cut part exposed to the atmosphere. Okay, turn it upside down, place it on a plate or a katori, and then put it in the fridge. Your only goal should be, do not expose it to open air. Okay, green peas, if you cook for 5 minutes, you just lose 10% of vitamin C. That as time increases, the more you cook your vegetables rich in vitamin C, the more you will lose vitamin C. The numbers you see here is the percent of vitamin C lost. Okay, So that's all about vitamin C harvesting and good sources. Okay, it's mentioned on page on table 21.2, page number 408, 409. You can just go through it, do a self study, read it. Okay, you will get a lot of insight about good sources. And definitely vitamin C rich food can reduce the risk of lot many diseases: stomach cancer, oral cavity cancer, pancreatic cancer, esophageal cancers. Okay, because they are antioxidants. They are taking care of the free radicals. Obviously, the risk of cancer will come down.